I've had a total hip replacement in my right hip, and I'm five and a half weeks now out of surgery. Okay, well, it took me quite a long time to decide on total hip replacement full stop. Psychologically, that felt like a massive decision to me, and I exhaustively explored every other option I possibly could. So, conservative treatments, so physio, chiropractic, acupuncture, the works, loads and loads of Pilates, yoga, you name it, anything other than have surgery, and then anything other than have a total hip replacement. So after the penny had dropped, I suppose, eventually, that a total hip replacement was the right option for me and would help restore the range of movement and the athleticism that I was losing, but also to reduce the pain which I was suffering. So once I'd accepted that, then I started to do really detailed research in terms of what was the best surgery. And I would have gone anywhere, I would have done anything, I would have paid anything, I think, really, to get what I thought was the best. Because it felt so momentous at my age. I wanted to avoid, if I possibly could, having to have a revision surgery for as long as I possibly could. So I'm used to doing research, so I work in university, and I found there was readily available information on the internet about the Mako robot. So I found that information quite quickly, and I guess it was just good luck that it was available in Leeds, actually, where I'm living. So I felt like the stars were aligning, and I quickly found that the information on Mako calmed down some of the concerns I had heard about difference in leg length and the positioning of the prosthetic, and the amount of cutting of both the bone and the soft tissue. So I felt that the Mako was important because it helped make consistent and I guess increase my chances of having the perfect surgery. So I looked on the National Joint Register at different surgeons who had been working in this area. And again, because it had taken me quite a long time to come to the decision to have a total hip replacement, I'd seen lots of different surgeons. And so I looked at those different surgeons on the National Joint Registry. And what particularly stood out about Mr. Conroy was the volume of total hip replacements that he'd done. So in my simple mind, the number of times you practice doing the procedure, the better you get at it. So irrespective of how talented you are and passionate, just practice makes perfect. And Mr. Conroy's volume of total hip replacements is massive compared with other very experienced and passionate and practicing surgeons in the field. So that, combined with the Mako at Leeds, made Mr. Conroy a really good choice for me. Yeah, definitely. It's so clean here. So again, in terms of making sure that I was going to come out of this with a good outcome, that is probably my #1 priority. We were obviously in the midst of COVID, and I did have a little wobble in the run-up to my surgery because it was February the 8th. So we were in the middle of COVID, so I had a little wobble. So I rung up a couple of people at Nuffield and got massive amounts of reassurance about infection control. So those two things, and while I was a patient here, the staff are very friendly, but they're also very professional and courteous and polite. So I always felt safe and I always felt very well cared for. So I came in on a Monday morning, so I was in quite early at 7 AM, but my surgery was quite early as well. So that was really nice, so I didn't have long to wait and get nervous. So I was shown to my room straight away, had a good look around, made sure it was immaculately clean, and I liked that. So I felt immediately calmed down that it was very clean. There were lots of people coming in and out, explaining who they were and what the process was going to be. And then very quickly, within a couple of hours, I was taken down to theatre. So I walked down, so again, I felt perfectly normal and comfortable. I didn't get agitated at all. I had a spinal block rather than a general anaesthetic. I was quite anxious about that. I didn't want a general anaesthetic. I was happy to have the spinal block, but I was anxious just because it sounded as though, you know, it might be painful, things might go wrong, and so on and so forth. But the anaesthetist had given me, again, a lot of information about what to expect. And it was so quick, I didn't actually really notice anything about the procedure. And then before you know it, your leg's gone numb and you're lying down nice and flat and comfy. I was wrapped in something very warm and cosy. So I felt very, very relaxed throughout the whole procedure. It went very quickly. I think the whole thing only took about an hour. And then I was back on the ward, so the procedure was really straightforward. I stayed in for 2 nights. I did, yes. So the physiotherapist made sure that I could manage safely on my crutches and go up and down stairs and up and down the corridor. So I felt safe, and I was collected by a family member who stayed with me for the first 2 weeks as well. So yeah, I felt safe and prepared. I'm 5.5 weeks. I feel like I've progressed really well. I felt like I was aware of making good progress almost every day. I never really had a lot of pain. I was discharged with painkillers, but I didn't really need much beyond paracetamol at night time. Sleeping is probably the most uncomfortable thing, just because you're waking up feeling like you'd like to wriggle around and lie on your side. But during the day, I felt very like my pain levels were well managed, and I was able to do the physiotherapy exercises which had been given to me. So I progressed from 2 crutches onto 1 by about 3 weeks, but I was in no hurry because I was really conscious that I wanted to walk without limping. So I took my time going down to 1 crutch and then no crutches. But your brain sort of lets you know when it's ready for you to walk unaided. So after 3.5 weeks, I was walking without crutches inside and taking my crutch for a walk outside. But again, for me it was more, and my physiotherapist explained this to me, focus on doing the exercises really well. Don't get hung up about walking lots, because it's the exercises which will help you recover rather than just trying to walk too much too soon. But yeah, no, I felt like I progressed very quickly. What was most important to me was how well managed the whole process end-to-end felt. So I had a lot of information. I was hooked in with PhysioCure, a physiotherapist, with Louise Grant and Matt Duke from the outset, and they helped me get prepared for surgery too. So I did a prehab programme with strengthening, and I had a lot of information from Louise about what to expect. So I felt psychologically and physically really well prepared, and for me that was important. And then everything that happened to me I was expecting to happen to me, so I didn't have any nasty surprises, which again feels really good. So it felt like the whole thing was managed really well, and the whole team seemed to be working together to get me the best outcome, you know, a perfect outcome. So I felt like the standards were set very high, and I was helped to get a really good outcome by everybody. Well, definitely. Certainly from the research I've done, because it's not new, so the Mako's been used for decades now in the States a lot, so it's not new, but it's evolving all the time. And there's a lot of information on the web about people who've had that surgery now going back decades. So I feel like it's a very safe way of getting a consistent outcome to your surgery. And so, you know, you have one chance to do this, don't you? So you want to line everything up and make it the best possible outcome. Definitely, just for all the reasons I've said, Mr. Conroy, you know, it's that volume and the practice, the volume of surgeries you've done, and your use of the Mako, and you let it slip that you had a Masters in Mechanical Engineering. I'm, you know, head of an engineering school and university, so that again, it felt like, okay, here's someone who's so passionate about using the robot that they've got a robotics postgraduate qualification. So I thought, right, this is definitely the one.